I know, when technology works, just go with it. So I'm good to go? Yeah. Great. Good afternoon, everyone. Delighted to be here. Firstly, congratulations to Quest on today's event. Certainly the feedback from this morning has been very positive. I know everyone has really enjoyed it. It's great to see the links with Quintet being further strengthened and developed. And just to say big congratulations to Catherine and Andrew on today's event as well and reaching the 1 year mark. For this afternoon's talk, if someone keep an eye on time for me, because I usually have a tendency to go on. So for those of you that don't know me, my name is Sandra Galvin, and I am the Programme Manager for the HRB-TMRN since its inception in 2014, where I originally joined as the Coordinator and recently got the promotion to Programme Manager. So they've decided to hang on to me for a little while. I use a lot of familiar faces here. I'm sure a lot of you know Professor Declan Devan. Declan is a Professor of Midwifery right here in the School of Nursing and Midwifery in Galway, and he's the Scientific Director of the network, again, since its inception in 2014. He was the lead on the first bid that went in to the HRB in 2014, and they came up with the concept for this whole network along with an executive board of co-applicants, and has continued as Scientific Director in our current renewal phase. So I'm delighted to say I'm standing here in the second phase of the HRB-TMRN. We are currently in a no-cost extension for the first one, so the two of them are now going side by side, but we seem to be managing. You notice the dates I've put 2014 to 2021, ... So far so good. And certainly when we had our international review panel feedback with the HRB, there was talks of TMRN 3, so we got very excited when we heard that, just smiled at them and said, yes please. So I hope we'll be around for a lot longer. The newest addition to the network is Ms. Carol Burke. Carol is our Senior Administrator. This was a new post that we could create with the increase in funding. We're delighted to have Carol. She previously worked here in the School of Nursing, so again a very familiar face. Delighted that she has since started with us, and again hopefully will continue with us into the future. So I know a lot of you may be very familiar with the TMRN. I'm kind of going to give a whistle-stop tour of TMRN trials in Ireland, the bigger picture, and then burrow right down to our relationship with Quest and maybe share some developments. I hope you don't mind some newer developments that have just kind of happened in the recent while again, and just share with you some of the aspects of our renewal and what that actually means. So as I've said, again, we're in a renewal phase. I was able to join on this as a co-applicant to secure 1.75 million from the HRB to continue the network over the next 4 years. We are, the funding is spread across 5 university partners, with NUIG being the administrative and kind of lead hub because the staff are based there, the 2 staff that are employed in the network. But we're very proud to say that we have over 50 collaborations both nationally and internationally. So I'll talk a little bit more about the national collaborations in just a second, but this has also ranged from us leaning heavily on the MRC, HTMR, the Hubs for Trials Methodology Research in the UK, who've been fantastic in letting us learn from them because this was also very new to us when we started, right up to developing a bespoke online journalology course with Dr. David Moore in Ottawa in Canada. So the list is vast and various and it's at different levels, but we're delighted with each. So the main pillars of activity that we have, I won't go back on the slide because of the recording, but the main pillars of activities that we have, very similar to that of Quest, and that is because when Quest was put together, the design of it was mimicked in our structure so that it would best fit in. So that is involving training, support, and also as a funding body for research and development. So I like to call this the party piece slide. So this is the bit where I like to show off, and people say to me, how many people are in your network? I could tell you that there's 2 people in our network, myself and Carol, because we get a salary from the network, or I could tell you that there's 3,821 people in the network. That's the size of our mailing list, and that's the number of people that we communicate on a fortnightly basis. And that database is developed all the time. We're always adding people to it. People can add themselves to it. And it's a great way of communicating and spreading the message around trial methodology nationally and internationally. We also, one of the aspects that we work on is HRB grant application support. Now, without going into too much detail, it's broad and varied, it's tailored to the individual's needs. But just as an example, the last round of the DIFA call with the HRB, which is the Definitive Intervention and Feasibility Awards call, over half of the applicants contacted us at some stage prior to submitting their application. Some of them we went in as co-applicant, some of them as collaborator, some people we had to decline, some people we just gave advice to. But the fact that over half of them were contacting us centrally before they sent in their application, I think is great. The next round of DIFA is due to launch on November 1st, in case you hadn't heard. It's going to be a two-stage application up to €1 million for a definitive intervention or feasibility award with the HRB, and again we're embedded within the guidance documents and we're going to have people coming through our doors. Great opportunities for us as the TMRN, and obviously great opportunities for Quest, as I'll show how the relationship works there as well. So we have our website. We're very much an online presence, which I think is 117,000 kind of sounds good, so I kind of said that's a good number of page views. We're active on Twitter. We have almost 1,900 followers spread across 49 countries. Majority are based here in Ireland, and we have about a 20% follower share based in the UK, which I think is good to know because we have a shared interest with trial methodology there. I suppose just under about 2.5 years, I have to update these metrics for the final year, which is the final third year. But we have been involved in organising over 160 events nationally, which has resulted in over 1,700 hours of teaching specific to trials and trials methodology. And this has resulted in over 6,000 people attending our courses in the first 2 years of our award. So that's why I call it the party piece slide. If the previous slide is my party piece, this is certainly the HRB's party piece. This represents €227 million worth of investment by the HRB in the infrastructure nationally. So I hope I'm not going over and back too much on this and people are probably sick of hearing about the jigsaw, but to the right hand side we have the older more infrastructural support, so physical buildings, so the clinical research facilities that we have in Galway, Cork and Dublin. To the left hand side there's the newer levels of investment, so these include the Clinical Trials Networks Ireland. I'm going to hope everyone's familiar with them, but don't worry, I'm going to go through them with you and tell you a little bit about them. The two pink pieces in the middle, we're very proud to be one of these, the HRB-TMRN, along with our colleagues in another acronym called HRB-CRCI. You'll get used to the acronyms as I go on. This is a HRB Clinical Research Coordination Ireland. So the other networks then to the left in the blue are primary care, mother and baby, stroke, critical care and cancer. These are disease or topic specific networks that are funded to conduct a network but also to deliver on trials in that specific area. And I believe there's going to be another CTNI call next year, so this jigsaw is certainly set to expand. I was kind of thinking, well, what's the impact of that jigsaw and can we maybe pull a bit of an impact? And I just took a quick look on clinicaltrials.gov. And I wanted to take a look at the number of all trials. I didn't put any criteria on this, it's just all trials that are registered in Ireland during this time point. And I think certainly in the last 2 years of 2015 and 2016, maybe that spike is attributed to the revival and the renewal of the infrastructures that are available, hopefully making it easier for people to do trials in Ireland and more appealing also. So just going back to the jigsaw, if you kind of pull that apart and put up some nice logos, just again, I think it's really good to know and recognise each of these networks because you never know at whatever stage you're at in conducting a trial, or indeed if you're interested in embedding trial methodology and you're looking for a trial, these could be some places where you could go and get some get active in an ongoing trial. So the two pink pieces of the jigsaw you'll remember were ourselves and HRB-CRCI. So I'll talk a little bit about our role in just a moment, but for HRB-CRCI, they're really like an umbrella body over all of the clinical research facilities and centres and over all of these CTNIs, these clinical trials networks. And basically their role is to be, I suppose, like the shop window for Ireland when it comes to doing trials here. So if a big multinational wants to come and have Ireland as a site for its trial, there's one shop to go to. You can go to CRCI, talk with them, and they can either navigate you through these networks, navigate you through the CRFs or the CRCs, and help Ireland become a venue for trials. And that's why we're kind of, I suppose, the overall arching supports across that jigsaw and across these networks. So then we have the 5 currently funded CTNIs, and as I said, this is set to expand. We have them in stroke, which is Peter Kelly and TCD. We have them in critical care, which is Alistair Nicholl and UCD, who does a lot of methodology-based research as well, which is really fascinating stuff. And then we have, you're probably familiar with Andrew Murphy's primary care network, which is here in NUI Galway. The long-standing Cancer Trials Ireland, formerly ICORG, if that maybe sounds more familiar, and the Mother and Baby network, which is between RCSI and colleagues in UCC as well. So again, there's networks, they're active, they're doing trials. If you're looking for a trial to embed your methodological research in, there's people to call. Kind of the activity, just a snapshot of one of the networks. and have a look at what they're doing in the different spaces. So really this is just to kind of pull out the topics that are on this slide. So Adele Murphy would be the development officer for the primary care trial. She set me on this slide, which just looks at a snapshot of the trials that are taking place both on the different east and west of the country. We have it in resistant hypertension, there's a low salt diet trial, there is an influenza study, there we have the Satin trial, waist and urinary tract infections, type 2 diabetes. There's a wide variety of primary care based trials ongoing. And as I said, I could put up a slide. I'll just show you that one. So this brings me on to our remit and the HRB-TMRN and really what we are about and what quests are about. And I think actually it was Patricia that coined this phrase. Doesn't mind me stealing it from her. She said, I was trying to explain this to her one day, and she says, so you mean it's not trial morology, it's trial methodology. And this is, I suppose, a concept that some people find a little bit harder to grasp because it's quite new. It's something in the UK that they're very much more comfortable and familiar with, but I think we're making headway here in Ireland with them getting to grips with this being a primary research area in its own right. So what is it? It's not just the doing of trials to answer a clinical question. It is because, as we've seen, there's plenty of networks out there. You've got HRB-CRCI, there's lots of people doing trials to answer clinical questions. Where do we fit? Where we fit is that we want to make trials more relevant, more accessible, more influential, more cost effective by answering methodological questions. So that can improve your current trial, or it can hopefully improve future trials down the line. And usually when you put enough rigour and enough energy into your methodological study, it should be relevant for more trials down the line. That's where we fit in, by embedding methodological pieces of research. Example of what we encourage, and I'm delighted that a lot of this is embedded within trials within each of the CTNIs that I've just mentioned. So the first item, for example, would be core outcome set development. I know we have at least 2, if not 3 or 4 in the room working on core. Jenny's probably working on a core outcome set. Am I wrong there? Patricia is. Sinead is. So core outcome sets, and again, without going into too much detail, are basically the minimum set of outcomes that should be included when you're reporting on a trial. So at the outset, you should work on developing a core outcome set that you will at least have this minimum set that then can be replicated across trials, that we can pool the results and we can start standardising what's been reported in trials. The conduct of evidence synthesis, I know that Catherine's already spoken about her review, and a lot of the evidence synthesis work would be again embedded within the CTNIs, and we have lots of examples of that, not just Cochrane systematic reviews, but other types of evidence synthesis also. And of course, I probably should have put this at the top really, the studies within a trial, or SWOTs, are really the mechanism for embedding methodological research within trials. So it's like, sometimes it's running a trial within a trial, and again, the question that you're asking is a methodological question. So it could be something along the lines of, you have a trial, but you're looking at the best methods to recruit a GP within that trial, like what the work Sinead is doing, looking at the difference between different types of leaflets or different media to get people to join the trial. The answer to that is methodological, but the impacts of it can have great benefits for the current trial and future trials also. And then one thing that we've, I suppose, didn't realise we'd be doing is fostering and encouraging a healthy approach to conducting trials. Start with a feasibility, then work up to a pilot if you need it, then work up to an intervention. Crawl before you can run, because we often get people, a month before the DIFA deadline, or maybe even 2 weeks before the DIFA deadline, convinced that they're doing a full-scale intervention, having never done a feasibility or pilot work. And a lot of that is time that we put into going back and forward with them and directing them in the right direction to tailor their projects. This at the start, and it's about this whole idea that we're playing catch-up, and we've had to put a lot of work in the last couple of years into addressing the gaps that were there, because there were significant gaps around training in trials. So people kind of weren't ready for the methodology concept, but they needed to know how to do a trial. They needed to know all of the different nuances within that. So we've had to kind of bridge that gap. We've had to provide basic trial training. So a lot of the online supports on our website address that gap. There was a lack of appreciation and courage for driving the methodology agenda forward. Again, not a lot of people realising that they could conduct entire studies just on the methodology part. They don't need to answer clinical questions. You can do a whole PhD in it, Marina, can't you? And again, this lack of networking. Who can I call? Where do I go? Again, a lot of the resources on our site are about that linking of people, and a lot of our events, of course, the symposium next week, another large event where people will come together and get a chance to meet and network and share their expertise. So finally I get to the juicy bit, the bit where I'm sure you're all converted. Is there a place for qualitative research in trials? And there certainly is. There's be a bit of overlap, I suppose, from what Andrew and Catherine said this morning. This absolutely came from a recognition of the amount of knowledge and experience that was within here in the school and in NUI Galway with regards to the conduct of qualitative research in trials. And it became quickly aware that this was unique enough, that this was substantial enough, that this could be packaged together as something, again, to lean for us to lean on, the TMRN to have a place, a go-to place when you need to have, when somebody contacts us looking for methodological guidance and expertise. And again, all of the activities of Quest are mirrored on the TMRN activities because they're all linked, and they're linked actually electronically pretty much because our databases are linked, the online support services are linked from an automated point of view. So it works quite nicely in that that Quest is embedded within the TMRN. And we again go back to when we applied for the funding to the HRB and we had our international review panel. The feedback was so positive coming from the establishment of Quest and the recognition that qualitative research was getting in Ireland. They were very positive from that point of view as well. A bit dramatic, I don't know if I've succeeded and I don't know if it's even clear, but basically this is a chasm, this is a divide. So as I've mentioned earlier, the first iteration of the TMRN was all about bringing people up to speed, bringing people up to a level playing field, that they were confident enough in answering clinical questions, that then they could become aware of this whole area of answering methodological questions. The TMRN is making a shift. We are trying to now use the second round of funding to get more technical. Our focus is going to be on answering methodological questions. We're now going to kind of stop this whole hand-holding, maybe going as collaborators on bids where we're just accessing us for a little bit of advice after the fact. We want people to take us on board as co-applicants. We want them to embed primary methodological pieces of research within their trials. That's going to be our drive going forward. And the reason I make it look like this is that I think there may be still some people a little bit nervous about that transition, but I think that's where it needs to go, and certainly the HRB recognise that's where it needs to go, and our international advisors have welcomed this transition for us going forward. Before I have much time left, if I am okay for time? Yeah, okay. So I'm just going to touch on a couple of projects that the TMRN have been working on where we feel that obviously we're working in the future with Quest, and obviously that there's scope. There's lots of scope here with regards to applying for funding, looking for a research question, or getting involved in various ways. And I'm very happy to give you more information on this. I realise this is going to be a lot of information in a few short slides. So the first is if you're looking for a research question. So you're interested in qualitative research, but you're not sure what exactly you should be investigating or looking at. So in 2015, the HRB-TMRN was lucky enough to get a KEDS award, the Knowledge Exchange and Dissemination Scheme award from the HRB. And we used that money to develop a set of research questions. Now that's putting it very simply. So I was delighted to work on this both with Declan and a much broader team, but also with Dr. Patricia Healy, who's down in the corner there, who was the activity coordinator on the priority study. So I don't know if everyone is familiar with the James Lind Alliance and a priority setting partnership. So basically the James Lind Alliance in the UK have already a tried and tested method of this PSP, a priority setting partnership, which is a protocol or a method by which you can go and identify research questions, and they usually are specific about treatments to research. So if you go on their website, you'll see a long list of different illnesses, like there's ones in asthma, there's one in COPD, there's lots of different illnesses, and you can click in with them. And basically there will be a list of questions that all of the relevant stakeholders to that disease group have ranked from 1 to 10. But what we decided to do was approach the JLA, get together a group of interested parties, the MRC HTMR in the UK, Trial Forge or in Aberdeen, Orca in Liverpool, and again a wider group of stakeholders through several surveys over a 1 year period. And we have adapted their approach, so we've developed a new methodology which I hope will shortly be published in trials, but we also have a top 10 and a top 20 list of research questions around recruitment to randomised trials, and we specifically homed in on recruitment and we burrowed down into that. So we're hoping that the idea behind this will be the website which will be shortly available. I'll certainly be promoting the paper as loud and as far as I can when it is published. The website is a nice, simple interface where people can look at the different research questions, burrow down and get some examples of the questions as well. And delighted to say I can share the top question with you today. Prior to publication, this is number 1. The questions are very broad. The idea is you interpret them and you embed different studies within them as you see fit, and you may have a different approach to others, but certainly some of them represent a fantastic opportunity for qualitative research within trials. So the top one is, how can randomised trials become part of routine care and best utilise current clinical care pathways? So just to reiterate, that question was selected number 1 across all of the stakeholder groups: patients, PIs, researchers, frontline healthcare workers. Everyone had a consensus around that question. So a lot of work went into getting that question. This is another project which we're very excited about. Hasn't yet started. But this was along with the bid that went into the HRB. We were delighted when they came back and said, please apply for a renewal of funding. And by the way, we'll give you some extra money to do some primary methodology research. We were thrilled. So it was a closed call to the TMRN as part of our renewal. And I believe I can say it's the first ring-fenced trial methodology funding call by the HRB ever. And hopefully an indication of what's to come. So this was for €350,000. The project is going to kick off in January. It's going to be primarily run between us here in the School of Nursing and Midwifery and our colleagues, Dr Valerie Smith in Trinity College Dublin. We're also linking in with both TrialForge, so Sean Truick, who Catherine mentioned earlier, who's in Aberdeen, and Carol Gamble, who's based with Orca in Liverpool. And this is going to look at, and nicely following on from this morning's theme, education and training for recruiters to randomised trials. So we're looking forward to starting on that one. That's going to be for 3 years. Marina, she's in the room. And just as I was picking and choosing them, there's a list of qualitative projects that the TMRN has, but I just wanted to pull these out as being particularly notable. I hope that's the right title. Marina's probably an older title, is it? Is it okay? So Marina is a PhD student based in UCD, and she's a HRB-TMRN PhD student. That's why I'm putting them up in lights. And she's working around understanding the statistical rigour in trials, specifically within academic and publicly led trials in Ireland, and using qualitative methods. And we have Jess Power, who's looking at the role of context and scale up in the implementation of healthcare interventions, and she's based in Trinity. And we do have 2 other PhD students as well, just not as qualitative as these 2 ladies are. And delighted to say that with the renewal, we have another cohort of 4 PhD students going forward. 1 will be based in NUI Galway, and Dr. Linda Beastie, who unfortunately couldn't be here today, but Linda is going to be supervising that PhD student, and Linda is a member of Quest as well, so that will be a qualitative based PhD study also. So I just wanted to touch before I finish on a couple of the new things, the new aspects of the HRB-TMRN, which I think are relevant for us all here today. As I mentioned, the DIFA call, the next one, is open on the 1st of November. If anyone is interested in maximising your outputs and addressing a methodological question within a trial, please contact us. As I've mentioned earlier, all of our contact services are linked with Quest. So if we get in somebody looking for help or assistance or co-applicant or collaborator in trials, we can redirect that to Quest quite nicely. There is more funding opportunities, so the HRB-TMRN is a funder. We have one award now annually of €20,000. So it is just one award. It is open to the 5 funded partners, which are UCD, TCD, UCC, NUI Galway, and UL. And it will just based on international peer review and ranking. The top award would be 20,000. We are going to have an open rolling call for educational events and training. So if you are interested in running pretty much an event like today, bringing people over from the UK, bringing in people with some expertise to give a seminar or a workshop, has to be relevant for trial methodology, which you can apply for up to €2,000 per award, and they will be assessed on a weekly basis. So whenever you want to put in the application, it will be assessed as soon as we can get to it within a week. So it's a nice opportunity to increase that networking component even further. We will continue to have our summer scholarship awards every year, so there is one within each of the 5 institutions. And the nice thing about this is that the supervisor can submit an abstract and we will approve the abstract. So you can go find your summer student knowing you have the money for them. And it's the same as the HRB, it's €2,000 over 8 weeks, so 250 a week. And I think that's a nice opportunity. I know, for example, Elaine had a Dara working on a project with her last year, and some really nice outputs are usually gotten from the undergraduate summer scholarships. We're also looking to establish more working groups, and again this will be something that with Quest that we look at around this whole moving towards the methodological questions. So the first question that comes to my mind is, well, what should we be researching? Like the James and Lyons, the priority study, maybe can we rank the questions, can we do a prioritisation, that sort of thing. But that will be across as well biostatistics and health economics and lots of other disciplines. We're too much in time. Just to say again, sincere thanks to you all again, and thanks to Andrew and Catherine, and just to say we're really looking forward to what the future is going to bring for the collaboration that we have with you both. So well done.
Thank you very much, Sandra. Thank you.